Hi, I'm Brian Adriano and I will be performing the postural drainage. So, in postural drainage, what will be going to assess ineffective cupping, thick or sticky mucus, or secretion that difficult to cup up. And then, we will drain or hear the abnormal breath sounds, increase vocal fermiatus. And what are the contraindications of the procedure? What are the contraindications of the procedure? The Trendeleg position, head injuries, increase in cranial pressure, and then recent MI, and then the lung hemorrhage, and also the certain surgical procedure. So, in nursing diagnosis are ineffective airway clearance, impaired gas exchange, and then the ineffective breathing pattern. So for the planning, what are the materials needed? So here you can see the Trendeler's Bed Hospital if possible, but in this video I only produced the pillow so that the patient may be comfortable and to done the procedure correctly and properly. And then the chair. We have the chair and then the tissue and a paper bag for the secretion just in case the patient is secrete mucus during the procedure. So identify the clients and explain the procedure, what he or she should be done, or how can she or he can cooperate during the procedure, and encourage the high fluid intake during the procedure during the program if it's not indicated by other disease by other diseases rather. And then plant treatment so they not overlap with um, meals or tube feeding, and then put tissues and paper bags within the client, and schedule the treatments at appropriate times of daily, and also perform the hand washing to prevent the microorganism to transfer to the client or the client to transfer to the nurses. And lastly, the select congested area to be positioned and client appropriately, or the select congested areas to drain and position the client appropriately. So now we will be doing the postural drainage procedure. So the patient is now in the supine position. So by tapping the patient on the ribs for 2 minutes. And gan up. Sit. Puka. Sit. Oops. Kak. Ugo. Relax. Now the patient will be positioned in the prone position. Balik ko lang ito yan. Dapa. And tap over the for 2 minutes. Inhale, and then apply pressure, and then sit down. Sideways. Kamay mo sa taas. the ribs. Inhale. The other side. Come on, so. Breathe in. Okay, sit. Then go. Now that I will be done the procedure, have the client maintain the posture for 10 to 15 minutes and then record all the data gathered into the position, and then also and observe the expected outcomes. Lung sound improve or become clear, and then the sputum is more easily expectoral or expectorated, and secretions appear the normal in color or inconsistency, and if dyspnea is decreased. So all the gathered data or the mucus documented, recorded, and so that may be gathered all the data through the client or to the patients. So that's our for this postural drainage.